The photographs have been taken of the patient smiling, and the intraoral photographs with their lips and cheeks pulled apart. The photographs, when they are taken, should be standardized so that there is not too much of a distortion factor involved. With these photographs, we can rotate, and we can also change their magnification factor. As you can see here, I can change the magnification. We use the dental alignment guide, which is represented here. These 4 teeth are used to align not only the facial photograph but also with the intraoral photograph. We use the lip outline tab to create a hole in the window. As you can see here now, we can pull the photographs back that are overlapped, and they're quite reasonably well aligned with each other. Obviously, the more time you spend on it, the better and more realistic it's going to be. We also have a shade guide, which we can use to create, in this case, the buccal corridor, and we can also increase its intensity and lightness. We can also pick various colors to make this fit. If we next tab onto the prosthetics tab, we can now place the teeth into position. These teeth are designed in such a way that they can be adjusted in color, shape, translucency and form. This is an example of where these teeth can be used not only as prosthetic teeth but also as veneers, as demonstrated here. If we now click onto the actual teeth, we can now start doing some adjustments. By using this point here, we can change the zenith positions. If you notice, they're moving away from the center line, which is the natural position for them. Also, what we can do is change the gloss, namely we can go from glossy to semi-gloss. We can also change the shape of these teeth from square, tapering and back to ovoid, which is the best one. The next aspect is that there are gaps between the prosthetic teeth and the gums. Using the prosthetic gum tool, we can create here what will be the appearance if prosthetic filler is used to fill in the voids. This is not meant to be a Adobe Photoshop shoot where we can create something that we cannot do clinically. This is meant to be as realistic as possible. Getting back to the teeth, we can change them not only in their we can change their shape, and we can also change their translucency. We can go from no translucency at the incisal edge, we can use the blue-grey, we can use the brown, or we can use the white. This particular case is best fitted with the blue-grey. If we now come over to the final tab, we can now see what it is preoperatively and our virtual try-in, which is here on the left hand of the screen. The next is the intraoral photographs with the preoperative and the projected. We can also change the intensity where we can overlap the lips over these areas so we can show to the patient more realistically what is going to happen when the lips are fully retracted. With this program, you're able to demonstrate to the patient what you're aiming to do, and also the laboratory technician can be fully informed of your aim of treatment. This is not only a time saver, but also financially it makes it a lot easier, and you have patients knowing what they're letting themselves into before any money is being spent.